And Dr. Triwibowo to be here to address some questions from the participants. In the first term, I invite 3 participants to ask to the speakers.
We are speaking too much together.
Yes, please.
Okay, no problem. Yes. I think this for you. No, it's for you. It's for you.
My question addressed to
Please
Dr.
name, please.
Okay.
Name and
My
your-
name is Endang from Biology Faculty Unsud, Jenderal Sudirman University. My question addressed to Dr. Triwibowo. Based on your explanation that leprosy still exists, even a lot of people are infected in Indonesia. Why the government or scientists do not explain to community clearly and honest as well to how to avoid this disease, so the people try to prevent of it. Thank you.
Please, Dr. Triwibowo.
That is very nice question. Why we don't have any explanation from the government and also scientists? Actually, we have now, right? Yeah, the leprosy is still the problem now. And the thing that we have to consider is regarding to the transmission. The onset of this disease is quite long. The longest reported onset is 32 years. So meaning if you meet some leprosy patient here, for example, and then you got spread by the droplet and you got infected and the leprosy entered to your body, meaning it might be 10 years after or 12 years or 20 years after will be manifest. So I think I cannot explain why government using it. Okay, I will propose with you. Yeah, thank you very much. I think it is big concern for us, and our topic is neglected tropical diseases. Right, it is neglected by everybody actually. Right.
Okay. Any more questions? I'm sure there will be. There must be a lot of questions from parasitology department.
Yeah.
No? No question? Maybe I would like to ask to Professor Alexis. Is there any kind of in vitro model for doing experiment with soil transmitted helminth?
Well, in vitro model, it's quite hard because most of these elements do not grow in vitro. You can, of course, have Caenorhabditis elegans in a laboratory, but it is not really the target. So you can work on Caenorhabditis, which is easy to cultivate, easy to have. But what we can do is to work with, for example, Polygyrus hemato. I'm sorry, it's coming back. Well, an element of mice that you can. It's a parasite of the digestive tract. You collect the faces. You have the eggs. You collect the eggs, and these eggs give larvae, which can be infective. So you can work on the adult who is in the digestive tract, and the eggs and the larva, ex vivo. But except Caenorhabditis, I don't know any efficient models. The study by Merck concerning ivermectin was made on Caenorhabditis. Okay?
Okay, thank you. Any question? Maybe I will count 1, 2, 3. If there is no question, then I will close this session. Yes, please.
My name is Astika. I'm a student in the biomedical master. My question is, what is the best approach for developing this kind of drug for neglected tropical disease? Because as we know that it is a neglected disease, so what is the best approach to make this drug? That's all the question.
It's very hard to answer. The best approach, I'm not sure I can answer anyway. It depends on what you want to do. If you want to cure the population, that should be our purpose, all of us here. I think the approach must be the elaboration of what can be called traditional, an improved traditional treatment. You standardize, you carry, this is efficient against ailments. You grow it in conditioned down. You collect it. You verify. You check the efficiency and in model, and then you sell it. But you control. You don't try to make the drug, the pure molecule. So this will give the opportunity to treat a lot of people, and that do not cost too much. As you said, they are neglected, and we will not have a lot of money. The second way to work is to find something which is very interesting, a drug, a molecule which is very interesting with an original mode of action, and then you can publish in a good paper, good journal, and then you may have a little money because you are the specialist of something. But this is not as efficient for the population. The third way is to convince political government and people like that to put more money in education, health, formation. That's what I should say. If you want to say more.
Yeah. So some of the NTD, the problem is not in the drug. Sometimes it is because of the surveillance is not really good. The awareness of the people and the awareness of the health system is not there. For example, for the Prambusia, the treatment is quite effective. The leprosy actually also quite effective. But the problem is another thing. It could be in a diagnostic, could be in a promotion, could be in a prevention. Yeah. Thank you.
May I?
Yes, please.
I will ask to Professor Alexis. I'm very interested in your talk about natural substances for helminthiasis. And helminthiasis is one of the big problems here in Indonesia for the children. So how far for your experience the exploration of natural substances to combat this helminthiasis? Because we are so diverse, so biodiversity in Indonesia is very high. So if you have this kind of experience, that will be good for our development of drug for helminthiasis. Thank you.
Natural substances.
Well, it is a great chance for Indonesia to be such a high spot of biodiversity. I think you have both natural substances which can come from earth, plants, fungi and things like that, and come from marine organisms. So, well, after you must have the chemists who are able to purify and to characterize what is in the natural substances,